Hey guys, Dr. Courtney here from Durrum Chiropractic and Family Wellness. Today again we're talking about low back pain, but I wanted to go over with you some of the tools and the techniques that we use to create a differential diagnosis and find out what's actually causing your problem in your lower back. One of the things I want you to understand first when we're talking about low back pain is that low back pain is actually a spine problem. In most cases, it's a nerve problem. We know that your brain controls all of the functions in the body and that your brain sends signals down through the spinal cord and out to the body. So for all of the cells, the organs, and the tissues in your body to truly be healthy, this needs to be a clear, smooth connection flowing up and down through that body. The brain's got to have a clear pathway to send signals down, but the reverse is also true. Your bodies, the organs and systems, need a clear pathway and route back up that spinal cord to be able to tell the brain what's happening in the environment around it as well. All right. Now, most folks understand that when you have problems in the spine or a pinched nerve, something that we would refer to and call a subluxation in the spine, they always assume they're going to be able to feel that. And in some cases you can, but I want you to understand that that's not true in every case. All right. So this chart represents the sensory nerves of your spine. And the sensory nerves are actually less than 10% of the nerves in your body. So only approximately 9% of the nerves in your body are sensory, meaning that those tell you how you feel. And do you feel good, or are you experiencing pain? So the other 90% of the organs in your body and in your nerve system are controlling the function of these organs and systems. So everything from your vision, your heart, your blood pressure, the lungs, so your respiratory system, your stomach, colon, the digestive system, your reproductive system. These are all controlled by what's called autonomic nerves of the nerve system. And again, this represents about 90% of the nerves in the body. So you feel the 9% sensory. These autonomic nerves, you don't feel. So we need to have a way and a tool to be able to test your nerve system to know primarily how are these nerves functioning. So for that we do spinal scans. We do two different sets of spinal scans. The first one that we do is called a thermography scan. And this scan rolls up your back and it's actually measuring and testing the temperature of the spinal cord and the nerves directly beside your spinal cord. Now the temperature of the body right there is going to correlate with the nerve system because we know that it's the nerves that's regulating and controlling that body temperature. So anywhere that there's inflammation along a nerve, our thermography system is going to pick that up and be able to pinpoint and show us where there's problems with the nerve along your spine. The other scan that we do is called the surface EMG. The surface EMG scan is much like an EKG. It's measuring the muscle tone or the muscle action, again, right alongside that spinal cord. And that correlates with your nerve activity because muscles don't move on their own. They only move when the brain and the nerve tells them to move. Okay, so if you have areas of spasm, and oftentimes we'll see a reading really high on one side but super low, or completely lack of tone on the opposite side. This creates instability in the spine and your nerve system. All right, so a good analogy here would be the tires on your car. They need to be in alignment. If those tires aren't properly aligned, that creates imbalance in your car, and we know that that's going to wear the tires down much faster. They're going to deteriorate much faster. So when the muscles along your spine are out of balance, that actually speeds up the deterioration and the degeneration of your spine. Now, we know our body's smart, and we know that God designed our body to be healthy over a lifetime. It's our job to take care of it and make sure that we keep it performing at a peak level so that degeneration and deterioration doesn't occur. Now, in addition to the computer scans, we also do an extremely thorough set of x-rays, and we do this on most every patient that comes in. because the x-rays show us a number of things. Number one, they're going to show us whether or not you have subluxation. Okay, so we can give you a definitive answer on whether or not you're in the right place, whether or not we're going to be able to help you. They also give us a baseline so that we can establish where you are now, because in the future, we're going to circle back around. Usually approximately after that first 4 months of care, we're going to come back and we're going to repeat all of these tests. We'll do a side-by-side comparison so that we can see what type of progress that you've made, and we'll be able to demonstrate and show how much you benefited from the care, but it also tells us what do we need to focus on next and what type of care might you need moving forward. The other good and really valuable information we get from x-rays is it demonstrates and shows us how long you've had your problem. Okay, so the longer that you've had subluxation or misalignment of the spine, that's going to correlate with more deterioration, possibly disc degeneration, osteophyte, bone spur formation, loss of a good, healthy curvatures of the spine, and quite possibly in some cases, scoliosis or lateral curvatures of the spine. The good news is when we do these post x-rays, man, that's a fun visit. We get to do that side-by-side comparison, and so often we just see drastic and dramatic changes in those spines, and that's just really fun for us as doctors and the physicians taking care of you, but also for the patients. It's rewarding for them to see that the efforts, the time, the money, the home exercises, everything that they've invested back into their care has truly paid off. All right, so we do an extremely thorough evaluation. In addition to those things, of course, we're going to do orthopedic, neurological evaluation, posture assessments, and chiropractic exam, palpation to find exactly where those correlating subluxations and nerve interference are. We have a wonderful team of doctors here. Our hearts are really in the right place, and we just love to see our patients get well. We love to see them get better and get back to doing the things that they want to do, things that they have to do, and most of all, the things that they love to do. We like to see you getting back to being who God designed you to be, okay? So if this is something, again, that interests you, or you want to have your spine evaluated and checked out to find out exactly what's going on, click on the link below. We'll get you scheduled just as soon as we can, get you in and get you checked out. Hope to see you soon.